The majority of us take some form of vitamin or mineral or dietary supplement orally on a daily basis or regularly at least. This is an industry that's worth billions of dollars and most probably one of the fastest growing industries in the world. There's one very big snag, and it's a snag for every single one of us, and that's our gut. Whatever we consume orally needs to be absorbed by the gut. So we have looked at ways of bypassing this. Think about it like you're taking antibiotics. If you have an overwhelming infection, they give you intravenous antibiotics. For the simple reason it doesn't need to be absorbed through the gut. It's immediately available in the bloodstream. IV nutrients, intravenous nutrients, does exactly the same. We give you a nutrient cocktail. Usually this includes minerals, trace elements, vitamins, other compounds, some amino acids even, intravenously, where they are directly absorbed and available for use. In our practice, we use IV nutrient therapy for quite a few conditions. Most of our patients present with fatigue, pain, gastrointestinal disturbances, anemia, low iron levels. The best way to treat this is intravenously because everything is readily available. There are so many IV bars that have sprung up. The problem with that comes in that all intravenous therapy needs to be overseen by a doctor. It's dangerous because we bypass the gut as the gatekeeper to what we absorb. Everything we put into an IV is readily available. Something as simple as vitamin C can create serious complications, even death, if not administered appropriately for the correct condition. IV nutrient therapy has great benefits for every single one, from sports people to post-COVID fatigue, long COVID patients, someone who just wants to pep up, patients who have iron deficiency, and again, one of the most prolific symptoms that we have post-COVID is iron deficiency and fatigue. When you want to do IV nutrient therapy, be selective where you go. If you as a patient can pick off a menu, you're in the wrong place. It needs to be prescribed by a medical practitioner who's on site. Here at the T Clinic, this is one of the cornerstones of our practice. For more information, click on the site, go and look at what's available, or come and see us.